we're going to talk about the love hormone, also known as oxytocin, but the love hormone's better, and how that works with breastfeeding and expressing, and also with bonding with our babies and love, which are all nice things to think about. So we'll have a look at why it's important and what it does. We'll also look at skin-to-skin contact and what babies do in the first couple of hours after birth, and starting off early and getting that normal and good milk supply up and running, and also a little bit about bonding and nurturing touch with your baby and how this can influence your milk supply and how it flows as well. So this funny looking picture is actually the hormone oxytocin. It's my favorite hormone. It has an amazing role. It's all about love. When you fall in love with a partner, when you see someone you fancy, your pupils will actually dilate and they will increase to get in more of that person's image. So when I look at Hugh Jackman, I get it wrong every time. Doesn't matter what he's called, he's just gorgeous, and my pupils will dilate. When you are in a relationship and you will fall in love, that oxytocin is very much present. When we make love, when we make babies, and when we also go into labor, those contractions is that muscle in your uterus contracting under the influence of this very special hormone. This hormone likes us to feel quite relaxed, quite private, able to do its job perfectly. And when you've given birth to your baby, they will come up and be in contact with you and on your chest in skin-to-skin contact. And they'll look into your eyes, and a huge rush of this oxytocin love hormone will be flowing around your veins. It's also floating around your baby and helping your baby learn how to seek out and find the breast to feed straight after birth. So it's very, very clever. The other thing that's maybe not so wonderful with oxytocin is it makes us quite forgetful. So when you've just given birth, you forget about labor because you're completely in love with this gorgeous little thing looking up at you. As a new parent, you will be very forgetful. As a partner, you will have to get used to possibly saying the same thing over and over again. As a midwife, that's all our job is repeating the same information over and over again quite a lot of the time. But we know that that's normal, and it's a sign that you are just totally in love with this baby. Great. So how does oxytocin actually work in your breast, or how does the love hormone, and why is it important? This is a picture of the inside of your breast. But actually, if we get down to the nitty-gritty, imagine there's a bunch of grapes inside your breast. And the branches of the grapes come down towards the areola and the nipple. And this is where the milk comes out of. Inside each of these little grapes is maybe 100 milk cells that make the milk. But surrounding each one of those little grapes, which we call alveoli, is this little web of muscle cell. When you think about your baby, or your baby touches your breast because they nuzzle with their hands and their fist and their face, and they search for the breast, that creates hormones to be released in your brain, the love hormone. And what the love hormone does is it makes those muscles contract, and they squeeze the little grape of milk, or the alveolus, and they push the milk down the branches to the nipple. And this is known as the letdown, or the milk ejection. This is what is creating the milk to come out of your breast and leak. Does that make sense? So we need this oxytocin love hormone in order to push the milk down. That can be very easy and very quick when your baby is near you. But sometimes when you're expressing, you might not have your baby near you. And so we need to try and evoke these hormone responses as well. And that's why it's important to know about this hormone. When we look at straight after birth, we actually call it the golden hour. Because when baby is born, you have the highest amount of this love hormone circulating around your body that you will ever experience in your life, unless you have another pregnancy. And what the high levels of oxytocin in your baby does is babies will often come out and we put them on your chest and they'll have a bit of a rest, and then they might start to look around, look in your eyes and go, oh mum, you're so beautiful, I'm so glad, I couldn't wait to come out and look at you. And then maybe your partner might be there with you, and they'll have recognized partner's voice for the last few months, and as dad or mum or another partner comes in, and baby will start to look over at that recognizable voice, and maybe the fingers might just flare and look at you. They are very, very subtle signs, but within the first few minutes we'll actually see babies show recognition of mum and dad, or mum and mum. So the other thing that happens is babies will actually start to wake up, and they look at you, but then they start to go, I'm a bit hungry, I'm going to find my way to the breast. And you see all this sort of bobbing of the head and feeling around, and babies use their face a bit like a GPS system, and they'll be sucking their hands because the amniotic fluid tastes very similar to your colostrum, the first milk you have. So they suck their fingers and then they think, smells like colostrum over there, I'm going to go there. And some babies will bob like this, and some babies, you can see this baby finding her way down to the nipple and the breast. We may think that we are humans from the 21st century, but actually we're still primates. We do what our relatives of gorillas and apes still do, which is we get onto our mums and we can find the breast. Your midwife or your doctor will actually check your baby for those reflexes that we do, with our arms, with our legs, with our face. Those reflexes are all there to allow your baby to find the breast themselves and breastfeed. This is the easiest way to learn to feed, and the nicest way as well. You'll be amazed that your baby can do this. And it's all because of that very clever love hormone. What we see is most babies will actually breastfeed themselves in the first hour after birth. But occasionally some babies won't feed in that first hour. And that may be because you've had maybe a difficult birth, or you've had a cesarean, or perhaps there's been quite a lot of drugs within labour. And what we see is those drugs will go through to baby in a certain amount, and sometimes they're just a bit sleepy. And they won't do this first initial feed. And that's okay. It just means that we need to start expressing within the first hour as well, to make sure that we're stimulating that hormone and the milk cells, to start switching them on to start making milk. If your baby doesn't feed in the first hour, then what I want you to do, or I want every mum to do, is to maintain that skin-to-skin contact with your baby for as long as possible. A wonderful colleague of mine always says, you need to put your babies in the kitchen and then they will feed, okay? If you wrap your baby up like a little burrito and in the cot beside you and they're sleepy, sometimes you won't see all those subtle signs of I want to go and have a feed, and we might ignore them or miss them. If you place them in skin-to-skin contact, this is keeping those lovely oxytocin, love hormone flowing. It's allowing you to express your milk easier, and it's waking up the baby who suddenly goes, whoa, yeah, it smells good. It's like me, if my husband cooks a bacon sandwich, I'm going to wake up and want to go into the kitchen and eat it. So that's why you want to encourage babies being in skin-to-skin contact with you. Skin-to-skin will actually regulate their temperature. So this is when babies are naked on your naked chest. I would advise you keep their nappy on, because you'll never make that mistake twice. And skin-to-skin will also regulate their heartbeat. It will maintain a good oxygen level. And it also calms mums and babies, often as well dads or partners. So it has lots and lots of benefits, and it helps frequent breastfeeding or very good milk flow for expression. What we've seen in research is that if you have just held your baby in skin-to-skin contact and you start to express your milk afterwards, you will get higher volumes than if your baby's in another room and you haven't seen them or touched them recently. So we know the power of that hormone. If you are needing to express because you're away from your baby, or your baby's been born too early, or you've gone back to work, a common question we get at Medela is sometimes the milk doesn't seem to flow as well as when I'm breastfeeding. And what we often say is that we need to switch back on that love hormone. So if you're separated from your baby, look at pictures of your baby or recent video. Take some deep breaths. Try and be private and do some massage and gentle stroking of the breast area before you put the pump on. Also, don't look at the pump and go, oh, it's not working. You know, it's about turning on this relaxed hormone, so we have to be kind to ourselves. Also, looking at Facebook and the TV is really fun and can be helpful for lots of things, but maybe when we're expressing, it's not really switching on that perfect hormone. Perhaps if you're scrolling through shoe shopping, I might have a big love hormone release, but I wouldn't advise it. So these are the simple things to remember of when you're expressing to try and get as much milk out as well. We also know that touch, nurturing touch of your baby is incredibly important. When we're 7 weeks gestation, this is when we develop the sense of touch. It is the first sense you develop in your entire life, and it is the last sense to leave us as well. With oxytocin, we're actually teaching the baby about love and nurturing by holding them close and breastfeeding them, and their brain is growing and wiring and firing with these positive processes. Other things that are really important and help to initiate the love hormone is smell. Have you ever noticed when you're pregnant that your sense of smell is probably much, much stronger, and there's certain things you smell now and go, oh, I can't bear it. Your sense of smell is much stronger, and so is your baby's. You're designed to, when your baby is born, go, oh, God, you're the greatest thing I've ever smelt. And that helps your milk to flow. All these simple things. And again, babies, as we said before, know the sound of your voice. But also when you hear their voice, stimulates that hormone and that milk to be released. So bonding and contact with your baby promotes the love hormone. You do not need to restrict how much you cuddle and hold your baby. There has never been any rules that show that you spoil a baby by holding them a lot, by responding to their needs, by picking them up when they need to breastfeed. This is natural, and it's what we're meant to do as human beings. We will all bond at different times with our babies. And if you ever feel that you're not having that huge, great surge of love in the beginning, it may be delayed. And that's quite normal for some of us as well. And don't be frightened about talking to your midwife about that. But nurturing touch, breastfeeding, expressing is all about love and care for your baby, as with holding them frequently. So don't be frightened to do that. And lastly, I'm just going to talk about our thing which I also think helps relax mums. And this was a study about babies who breastfeed and the normal processes in the first from 1 month to 6 months old, and just looks at the average ranges of normal. I want you to come over to our stand, which is over there, and come and pick up one of these and stick it on your fridge, and hopefully that will give you a good idea of what's going on in the normal ranges of breastfeeding with your babies as well. So come and see us at the Medela stand over there. Thank you very much.